Hello, welcome to Revive Health's daily briefing live for Tuesday, June 9th. Our 30-minute review of the latest, most important news, resources, advice for health system marketers and communicators dealing with COVID-19. I'm Jeff Spear, your host for today's show. And as always, we're joined by Chase Kleckner, Senior Marketing Manager at Revive Health and our show's producer. Hi, Chase. How are you?
I'm doing well, Jeff. Good to have you back on the show.
Good to see you again, sir. Today, we're also joined by Chris Wickline and Jared Usry. Hi, Jared. Hi, Chris.
Hello.
Hey, Jeff.
Good to see you guys. If you haven't had the pleasure of listening and hearing from Jared and Chris, I'll give you a quick intro. Chris is part of our strategy team, consults with health system clients on branding, marketing, communications programs. She's also previously led integrated marketers at Health Grades, working with a lot of health systems across the country, maybe even some of our listeners, on consumer engagement, acquisition, and retention programs, and started her career on the payer side, leading e-commerce, lead generation, and retention marketing. And Jared, Vice President at Revive Health, also in our strategy group, has worked with dozens of healthcare organizations to sort through problems and preferences, retention, acquisition, and more. More than anything, Jared is a big believer in marketing being responsible for what consumers and patients want, but also for seeing what our organizations can mean to people. Great to have you both here. We'll get some of the caveats out of the way here, but as with each show, we're going to cover the latest news on COVID-19, how it relates to marketing communications, help you with some resources here, and share what we're seeing and hearing from Marcom professionals across the country. Today's show, we're really going to kind of do a little bit of a different format. We're going to go through what we see, maybe some of the strengths, weaknesses, opportunities, and threats that have arisen from the COVID-19 crisis, and maybe use it as time for reflection for a minute. So looking forward to that. We also definitely open to having some questions. So if you would like to add to your own thoughts, or maybe give us your opinions on what strengths, opportunities, and weaknesses you saw from your teams during the crisis, please throw it in the Q&A section and we can address that specifically. Or if you want to just chat with the fellow listeners, put it in the chat function. But if you have anything for Jared, Chris, or I, or Chase, please put it in the Q&A box. You can also subscribe to the podcast on iTunes or wherever you listen to podcasts. Just search for Revive Health Daily Briefing Live, and we'll post recording of this episode, and all the other archives are on our website, thinkrevivehealth.com/COVID-19, as well as other content we've developed related to the crisis. A lot of good stuff out there, and make sure you check it out. We know it. Most people can't listen every day, but it's definitely worth revisiting on a regular basis to see all the great guests and people that have covered really important topics. A couple quick notes. We are not experts on COVID-19, so it's not a place to come for medical or scientific advice, but we will share opinions on how marketers and communicators can manage the COVID-19 crisis. But everyone's situation is unique, so in the end, you got to do what's best for you. Just let us know how we can help. So let's begin. We'll quickly just cover, as we always do, the latest count of COVID-19. Just important to keep that as context. So right now, as of today, not this second, but today, the global case count is 7.156 million, and the global death is exceeded 400,000. We're at 407,326. In the United States, the case count is creeping up to 2 million. We're at 1.962 million, and the death count is now 111,000. The startling numbers I saw also today that while death rate is declining, cases is kind of not necessarily. It depends on where you live. So everyone, I think, right now is in different stages and places depending on the region, on how the communities are reopening. And I know, at least for me and where I live, people are going out, eating in restaurants, and I'd love to hear Chase and Chris and Jared what you're seeing, but I think it's hard for people to live in the in-between land where before everyone's wearing a mask, staying apart, but now that some things are opening, it seems like they've just kind of thrown it all out the window, because I see people right next to each other with no mask on, even though some places, the grocery store, everyone wears a mask, and kind of stays apart. But then at a restaurant waiting for their food, they're just right next to each other, and it seems like just a bunch of strangers.
Yeah, I think, what's interesting to me is my observation is that what I've seen in terms of behavior in the city is very different than behavior when I went to a rural area just about two hours north of where I live. I mean, you can't walk I live in the city of Madison, Wisconsin. You can't walk into a store without a mask on, basically. But when I went 2 hours north of here, I think throughout my trip and throughout my day, I saw one person in a gas station with a mask on. So very different behavior in different areas for sure.
Yeah.
Yeah, I live in one of those rural areas. I live on the outskirts of Nashville in Ashland City, and there's this store. It's Lewis Country Store right there. It's this off Route 12 here, and they have a sign. They put up this really clear mural that says, "If you're afraid, do not come into the store wearing a mask." And so it's kind of weird. It's to your point, Jeff, it's like this weird, like people want to be really done with it, or they want to be, or people are really respecting it. It's just such a weird thing. And I think it's really interesting going to a Costco versus a Walmart. Maybe this is just my personal, like Walmart and Costco, right? But like Costco, everyone's masked up. Walmart, it's like one out of 5, maybe. It's just a very different,
Right.
Maybe you're starting to see some the political realities of stores and who they appeal to as well.
And of course, we'll take this into what it means for our listeners and hospitals and health systems. But there's definitely, I think, the political part. But there are, I think, what I observe is the clear power of influence in society. So if you're in a grocery store, everybody wears a mask. You just put it on, and we've been doing it for a few weeks. But now we're going in a restaurant. And when you eat, obviously you don't have your mask on. So I think people feel strange then, or maybe not as much pressure, or just our tendency to say, oh, it's uncomfortable, I can get away with it, so they don't wear a mask. It's just very fascinating, I think. And for all of our hospitals and health systems that are now trying to get people into the hospital, you could take that as a sign for, well, see, a lot of people are comfortable, but that's not the case, right? Because there's a lot of people that still aren't comfortable, and they're not coming into the hospital, unfortunately.
Yeah, and I think, we heard some of the headlines this morning around different perceived guidance from WHO versus CDC, which is creating more confusion. And I think, just people are asking themselves, what is the right thing to do? And then what's the right thing to do for me? I think there's two layers. But yes, I think there is a big influence by the place that you're in. And, that kind of when in Rome idea.
When in Rome.
Yeah.
All right. Well, let's get our topic today. As I said, we were thinking about, well, what has or has not changed for health system marketers. No one can predict the future, but as a group of strategists here, we always at least say, well, let's take a lay of the land, and that's kind of what we want to do today on the podcast is just go to the tool that we've all used, strengths, weaknesses, opportunities, and threats, and share our thoughts on coming out of this, where we saw our clients and what we've heard from our clients and other marketers, what they observed of their teams. And we'll share that. And again, if you've got a comment, throw it in the Q&A function. Even if it's not necessarily a question, we can read it out loud to the group and maybe use that to prompt a discussion if you happen to be listening live. But that's what we want to do today. Maybe at the end we'll just sum up on what do we think that means for the future for us. And of course, the future is a big question mark for all of us. So by no means are we making predictions or bets in that way, but still important to think about. Let's start with the good stuff. Strengths. Jared, you want to go first?
Sure, I can do that. So I think what was really interesting was the rapid response that people had. in crisis, I think we've seen some marketing departments move fast. We tend to have a pretty strong view of issues crisis, I think, at our firm because of our natural kind of coming from that space. So we've worked with a lot of firms in that moment, but the widespread continual focus that digital and content teams brought, I mean, was really excellent, I think, in a lot of ways. We saw a lot of folks step up in a really big way. I mean, not across all service lines, and there were definitely some misses there, I think, but overall, I think the ability to respond quickly on those channels for digital and content really shone through for health systems. And I think that may be the first time that some systems we worked with had been able to move that quickly. Maybe that's part because of priorities are clear. I don't know, but at least it was a really strong point for us to maybe leverage in the future too.
Yeah, the nimbleness, quick decision making, and maybe just a ability to say we're not going to perfect something to death, and just know that we've got to move. Chris, what about you? What's a strength that comes to mind?
Well, I think, kind of drawing off of that speed, it was also how quickly we were able to align internal communications. Again, it was a little chaotic at first, I think, because that was just the nature of what we were dealing with. It was a chaotic, ever-changing situation. But I think from just like Jared mentioned, from an external point of view, I think from an internal point of view, we did a really good job of keeping staff involved with understanding what's happening with those key things like PPE, what's happening with how we're changing our own procedures or algorithms, what's closing, what's opening is now what we're starting to do in many places and well into that. So I think internal comms has been a strength in many ways, still opportunities for some improvement as we saw in the early days. And I think that as we talked about on this program, but overall, I think we did pretty well there. I don't know, what are your thoughts on that?
I agree. We heard from one client that they were getting a lot of praise for internal comms from their organization, from their employees, that previously it said internal comms just wasn't good. Now, some of that is, I'm sure, in the execution from the communication team. Some of it probably that people had a desperate desire to be informed and were therefore paying more attention.
Yeah.
And you're never going to get that all the time, but it provokes the question of, what are you communicating? Are you communicating the things that people care about? Are you doing it in a way that they care about? Or are you really just pushing something that's important to you? And we always want to communicate everything, but it comes down to what's most important and what's going to move people to action or changing their beliefs internally or externally. Go ahead, Jared. You have another example or a different comment?
Yeah. So I actually I got to talk to Alan Shoebridge last week, and he brought up how they used internal comms to kind of go through this like get ready process for reactivation, which was really, really cool because it kind of gave them the internal belief that like they were ready, like the team's ready. And I thought that was a really cool role that marketing got to play as part of that. Marketing and comms got to play because it got to set up the belief in the hospital that then translated out to the community, I think, in a pretty big way. So it was kind of a cool way of like converting and changing beliefs, I think, of internal team members before you try to convince the community you're ready. And I feel like that's such a cool place where marketing can be a leader in the right way in those conversations. So I thought it was a really cool example we've heard from a client in that area.
Yep. Okay, let's see. Another strength. Chris, do you have any more you want to touch on? I mean, we'll obviously get to weaknesses and opportunities and threats, but I don't want to.
I think just one last
good
thing.
Things.
One last thing, kind of going to the speed at which we moved. A lot of our clients and systems have ready-made opportunities or forums for connecting with their patients to understand what kind of messages resonate, what don't, what their concerns are, et cetera. And we did see a lot of our clients kind of spring into action to kind of take a pulse on their own patient base. I think that was also really positive. And, that along with the internal comms and what Jared mentioned, marketing was really seen as a key enabler of a lot of these things and systems. So I think that's a great opportunity for us going forward as well.
Great. And I'm going to add one before we move on to weaknesses, is working with physicians. I've heard from clients, we all deal with physicians in different ways. And one of the hardest things sometimes is either to engage a physician to help in marketing communication and getting input or participating. The other part is just getting criticized. So what I've heard is, understandably, and it's no judgment there, physicians were very interested in marketing while they were waiting for patients to come back and to figure that out. But I'm hoping that through that, physicians also gain trust in their marketing partners. They saw the value in it, and either will be more interested in participating in the future and receptive, but also more trusting that these people know what they're doing. So I'm going to sum up what I heard on the takeaway strengths. And part of it that I think in what can change moving forward is, can we make decisions faster?
Yeah.
Can we harness some of the internal energy, communications wise, but just of the organization, and figure out how to capitalize that and keep that when it matters? And can we spring into action a little faster and really make sure we're constantly getting the input from our patient base? I think those things are things that are more about processes and the actions you take, that we can say, look, this enabled us to be successful before, and we can put them into place in the future. Particularly, I think decision making in a large organization, where clearly in some of the stuff that particularly Jared opened up with, or even Chris on the internal comm side, that you don't have a chance to go get approval from 35 people. They just needed to go do it. And that's what marketing should be. It should be relatively fast and nimble, if you earn the trust that you know what you're doing. And I think all of our clients pretty much have. Okay, let's get in a little bit on the weaknesses. Chris, I'll let you start this one. What's some weaknesses here? And we're not condemning anybody. This is just, we all have weaknesses. I feel like I got to put that out there.
Yeah, I think the first thing that became really apparent is really kind of two things. I know Jared's going to want to weigh in on this one too. First, that our tech stacks were not, were lacking in many ways, and they didn't give us the ability to be able to really get out there quickly on a more personalized basis with patients. If ever there was a time when we needed to have connected technology to enable marketing, it's now. And a lot of us found weaknesses in that. And then of course, it really inhibited our ability to kind of execute that coordinated multi-channel outreach at a level of scale that was really required to kind of reach out and keep our patients engaged during the closures that we had in place.
Yes.
Yeah. We had a client who, they had unfortunately just transitioned some technology systems, and they had actually had like this gap where they didn't have email capability. And we all know the research kind of indicated that email was the most important channel to be on. And there was like this mad rush to get email approved and through all the technical and legal reviews, because they just needed it so badly. And luckily, we had some options like to solve in, with using EMR based messaging and things like that. But ultimately, it wasn't quite the same as if we had the chance to kind of do it, had the email platform ready to go. And it seems like such a small thing, but it's such a big thing in those moments where you really need it.
Yeah, for sure. I think, the idea that information's out on our website is great for patients who had an immediate need or interest, but there were a lot of folks that didn't. And, also kind of left them kind of lacking. People aren't just going to come to our website for the heck of it, right?
No, and this is marketing has so much power and influence in communications, and I think what we're hitting on is, and what we've seen this huge decline in volume, in understanding, in sophistication of our patient consumer base. And now a lot of places are at 80%. Well, 80% is great, but if we only stay at 80% for 6, 7, 8 more months, that's not going to be good. And we just can't afford to take anybody, any patient, any consumer for granted. And that's where I think this tech and what you and Jared are talking about right now is so important, because we just simply can't say, well, we can get most people by telling them that it's safe to come back in a general way. That's just not going to be an effective method, and technology is the way to go. What's some other weaknesses that you might have seen that our listeners should be thinking about now, and how they can make some adjustments for the future?
I think I think approval and like getting leadership aligned with direction is actually, I know we had that as a positive thing at some points, but I also think there were some moments where like there were also some real struggles getting things through leadership and knowing the messages that people wanted to hit on. I don't know if you guys, but we had some, and painful conversations, to be honest, right? Like in the moments where we had to make some pretty massive changes to messaging at the last minute because the right people hadn't seen something. And, glad to get the messages right before we go out there. But, getting buy-in, I think it exposed a little bit of the need for us to build stronger, more robust relationships with the C-suite and how to make sure that we can get messaging surface it early. So strategy, they can understand Marcom brand strategy early on. Hopefully that's a good indicator for future need. But I also think there were cases where we actually had the exact opposite, where it actually really built reputation with the C-suite because people realized that just how reliable marketing can be for those pieces. So I feel like my clients at least saw a kind of a mixed bag of responses on leadership buy-in and it really contextually specific as well. Christy, I guess you saw the same things as well. I'm guessing you had heard some of the same pieces.
Yeah, absolutely. And I think drawing something similar to that is, I think, we also found that we need much better partnerships with clinical leaders when it comes to how they communicate with patients. Because when all of a sudden we were faced with that outreach, we were faced with trying to get people back in now that we're reopening, kind of how that happens in the clinical space and how they talk to, their patients. We don't have a lot of understanding of that. We pretty much start at acquisition and end once they're in the door for an appointment. And that's a real area that we need to learn if we're going to be able to support.
I don't have nothing to add because I think it was well said. I was trying to think of something clever, but there's nothing more to say. That was great. Okay, let's go. I want to hustle just a tiny bit. Let's get to opportunities and where do we absolutely feel this is a big opportunity? Let's not wait on this. And we'll sum up at the end, but what's an opportunity that, Jared, do you want to start on this one?
Virtual health, also maybe virtual health. I mean, it's all acuities, it's all specialties, it's entry point to the system. It's just too big an opportunity for us to be waiting on. It's not to be the guy who will yell virtual or digital, but come on guys, this is the new front door. This could be the front door to our whole system in a whole lot of ways. And it just feels like the moment in time where we have to be prepared to prevent also competitors from coming into our markets and taken away from us. But that's, if I had to only list one, that would be the one.
Jared and I are on the proverbial same page on this. We talked about it in a podcast a few weeks ago, I think. And if you haven't a chance to listen to that, please do. But I will just say that we've got many clients and everyone's at a different place in virtual health. We've got some clients that are built for this and we're ready and we're pushing it and they were going. We had other clients that literally were having almost zero virtual health visits before this started. Of course, like everybody else, it went to hundreds of visits a day in no time. But now they're in this place where, what should I do? Should it just all go away? Because they weren't counting on it before. And our point of view is, no matter where you are, what market you're in, virtual health is an asset to you, and you should have a plan and you should build that vision and you should have a marketing plan, a development plan, a tech plan. It's an asset. It's a way to get people in the door. It's a way to get physicians to talk to physicians. It's a way to have maybe joint interdisciplinary visits. Everybody's place and division is going to be different, but it is absolutely something you need to plan for. And marketing has finally a very unique opportunity to hit the 4 Ps, as Jared always tells me, particularly in product and place here. And if you're not doing it, there's a billion things you can be doing, but this thing is important. And if you're not doing it, you can be sure one of your competitors is, and they're going to start stealing market share. And if it's not your local health system competitor, it's your health plan. So it's an opportunity, and maybe a threat, but really we're going positive, an opportunity. Chris, what's another opportunity?
Probably not surprising given my background in direct-to-consumer marketing and also my time at Health Grades is strong consumer segment understanding. I think we have, as marketers, we have a great understanding at a high level who our patients are, but when it came right down to it, I think we struggled as we were trying to think about our reopening and how to help clinical leaders prioritize to bring the most value to the system. And I think, again, that gets back a little bit to what we talked about, our lack of tech platforms or tech stack has made that a little bit harder. But I think that we've got a lot of opportunity to enhance that consumer segment, as well as, overall the value of patients to our system, but also at a service line level for those key service lines.
Yeah, so let me ask a question. If I'm a listener out there, I might say, okay, I love the idea of personalized marketing. I love the idea of segments, but my tech maybe isn't there, or I don't know how to actually do that in a way that I can measure the effectiveness. It seems like a lot of work to get a couple patients. Chris, it can't be the first time you've heard this question. Or Jared, if you want to also jump in. So what would you say to our listener there?
Yeah, I mean, I think, Jared definitely has a lot of background here as well. What I would say is, look, the journey of a thousand steps starts with a single one, and there is a lot of effort there. I mean, certainly there are some things that we could do to get kind of down and dirty and work around the lack of a tech stack as we were reopening. We talked about many of those on this podcast, but I think, it is a lift. It's not an insurmountable lift, but it takes commitment and it takes dedication. I mean, you can implement CRM systems and other tools fairly quickly, but you need that focus and that priority. And I think if ever there's been a time where there's, again, a burning platform, now is it when it comes to that, for sure.
Yeah, and I think it's, I know, not to Chris's point, it's starting simple, like personalized. You only get to really good attribution and measurement after you have the foundation of years of good data, right? Like where you have, like you build it up. So what do? You start with good inbound touch points. You get your HRAs ready. You make sure they're capturing source and all the wonderful things that go to that. You make sure that everybody who comes into an HRA or downloads a guide gets on a good nurturing program, and you make sure you give them relevant content. You start personalizing that content, right? Like these things, it's a little maturity ladder that once you start climbing it, the great thing is the next step almost always seems to come from the data. Like it almost always pulls you into the next, what could be better, what could be better, what could be better. And that'll pull you along. It's just a matter of getting started and kind of giving it the resources it needs, because it's not a light ask either. It's not like it can be easy. It doesn't mean that it's quick. There's a difference in those two things. I think it's pretty important to call out to Chris's point.
Have a roadmap, get a vision, and get started. Go to bat with your leadership. Use now and what has and hasn't happened, what success you've had, but you could have had more success, or what struggles you had that you could have absolved. And lobby for that investment, lobby for those resources and that Chris and Jared were talking about. I want to get to a couple threats, and then we actually have a couple questions too. So I want to get to those live. Actually, Chase, what do you think? Let's get to the questions, and then threats is not fun anyway, but we'll talk about them. But let's get to the questions first, and then we can get to the threats.
Okay. At the beginning, we were actually talking about how consumers have to make more personal decisions as states are lifting restrictions. And so the question was basically, do you guys have any ideas on how health systems can step into the gap left by states as they're providing less stringent guidelines? I have to imagine in many markets, health systems would recommend more restricted social behavior than the state or city may recommend. Can we become a community's go-to resource for lifestyle guidelines? Do we think we can pull this off in a meaningful way?
I would love to take this one, if that's okay.
Go for it.
And then Jared and Chris jump in. I have a strong opinion, and that's yes. If you're a health system, you're automatically seen, as we've seen from all of our data, as an authority figure in health matters. So as things are like this, and as people are trying to figure out what's right, do you want your consumers and the people in your area to trust you for that? or go to the CDC, or just go to the New York Times, where they're reading some epidemiologist talking about what you should and shouldn't do. And they're probably doing that, but you have a different influence there. And what I think we've seen, and hopefully we'll see from in the future, is the link between health systems and public health. Of course, we have funding issues. Of course, there's a lot that needs to go down, but marketing communication teams can fill that role and use it as a way to establish themselves as a true leader in the market. And this is a powerful differentiator from any other brand. I'm sure other health systems and other healthcare organizations can do it. But if you're thinking about doing it, do it. Because a lot of health systems won't do it. They will say, we don't have the time or resources to that. And that will not pay off in reputation. It will not pay off in community engagement and loyalty, and who do really people look to and value in their market. Jared and Chris, do you have anything else to add?
I think the only thing I'll mention here is I think you're right. I think it's inside our brand world. It's inside our area, and we for a long time have talked about the idea of population health, and that has meant in the way we define population health has been taking care of the sickest to prevent high cost. But I might argue this is the moment where we step up and actually start doing population health, which is very synonymous with public health in some ways, right? There's a deep connection there where we actually inform the greater population in some big ways. I feel like this is almost like missional need for us to step into this and say, it's our mission to do this. Like if we don't claim that mission now, I have no doubt it will be filled at some point. Like I have no doubt there will be public health agencies that come in and say, it's our job to do this because it wasn't being done. And so if we ever need to define your role in a community, if your tagline is, I'm here for this community or for this population, like when else are you going to prove it? Like not to be like throw a little bit of a gauntlet down for health system marketers, but like this is the moment for the brand to be the responsible one. So I don't know. It feels like everyone expects it from us. So hopefully we get some grace on the political side if we need it.
And one other thing to say is the CDC is great. No qualms with CDC, but your team is more effective at communicating those messages to people in a way that they understand will take action than the CDC. Okay, Chase, I think there's one other question, right?
Yep, there's one more. It says, I'm interested in what happens when we reach a high burnout rate on COVID-19. This is both in terms of our audience responding to the messages and us marketing professionals operating on an adrenaline rush that will be hard to sustain, especially in light of what are likely to be declining budgets.
Chris or Joe, would you like to give it a go? So to reframe the question a little bit, he's asking about COVID-19 on external audiences and internal audiences and the burnout of the message on each, or the burnout and employee energy.
I mean, I think those were actually a couple of our threats, right? So, I mean, I think we acknowledged that they're definitely there. I think, when it comes to internal and keeping our team motivated, I think, some of the things we've been talking about on this podcast, our organization needs this now more than ever before. I know it's been hard because it's kind of been this always on mode and really adjusting. But I think it's also, again, such a shining opportunity for us to show up and really bring value to our organization. So sometimes that rally cry is also hard when everybody's tired. But I think trying to leverage that to keep the motivation, and mission high is important.
Yeah, I might, go into this thought like this is also, if we think about that, like that responsibility piece of like burnout, I think it actually turns into a responsibility for us a little bit to start say this is why we need personalized communications. If I can declare that I'm interested in the content, then I probably am okay with you sending it to me, right? Like this informs the need for our stacks to be built out a little bit more, and this is the perfect time to do it. We have like the great catalyst of COVID, right? So what's the old phrase? Don't let any crisis go unused. I mean, like this is a crisis for us to advance our ability to communicate in an important way because people need us to communicate. I think realistically, we're all agreeing that it's going to be 18 to 24 months of this. I mean, from all intents and purposes, it sounds like that's. Yeah. So if we can use this as the reason for us to say, we have to start getting the list of people who are interested in what types of information. Do we have a list of heart patients who we need to make sure get critical alerts on a certain set of areas? Do we have a list of seniors that we need to be communicating to even more directly, especially as their requirements for social distancing may continue for a while? So for me, I feel like this is the need for change. I think we're going to have a ending media commentary. Like there will be less ability for like broadband messaging, like for broad audience messaging. I do think we'll have a lot of narrow messaging that can be really relevant for a long period. So for me, I think getting us ready for that moment is probably the most important thing we can do. In terms of burnout internally, I don't know about you guys, but we're already starting to do the PTO cycle at Revive, where we have like a couple of people take off on Fridays or a Thursday, where like people have been like on this for 12-hour days or 10-hour days for weeks at a time. And so we're starting to do that cycle now, where everybody gets their weekend away for a little bit, and that seems like it's already starting to help. I'm sure everyone in health systems will have to do the same thing at some point, because it's just too much if not.
I agree. And we'll wrap, and I'm going to just add a couple of thoughts to what Jared and Chris said. Externally, one thing that keeps occurring to me is how many times we have to tell people something. So the stat is at least 7 times for people to remember it, probably 37 for them to actually internalize it. But really, that's an exaggeration. I think what Jared said is, just like we say Joe Public doesn't care about your hospital, they may have been paying attention, but then they're going to forget until later. And we're still seeing stories about people that haven't gone into care because they're scared. So I say dedicate your time to figuring out what Jared said, those narrow messages that matter, and applying them, and continuing the other stuff there cyclically. Pay attention to what's going on in your community, and make sure that you're emphasizing things in the right way there. For your teams, I would use this in a way and say, you just went through this really intense period of time. What can you learn? What can I learn as a leader about how you want to operate? Because just like we're having this conversation, you can have it with your teams. And certainly I would say that the threat of employee burnout was one that Chris and Jared had put down on our list as we talked about, but there's some positives. We had health systems that have never done virtual remote work that are doing it now. And certainly nobody wants to do that full time, I think, necessarily. But I bet there's people in your team that say, you know what, a couple days a week would really help me in my life, whereas before it was completely frowned upon probably to ever work from home. Or are there things that now you can think about in your mission as a marketing team and how you can make decisions faster? Because what is, while right now they're working off adrenaline high, maybe what burned them out before was how long it took to get something done, or death by 1,000 cuts of approvals and trying to perfect something. So I would say sit down with your team, do the same exercise, reinvigorate them some, but yes, as Jared says, give them some time off. And maybe that's a rotating schedule for a while. But it's a real threat, and I'm sure all of you will have good answers for it. Thank you for listening. We're a little bit over, but it was a great conversation, and really appreciate the questions that came our way. Jared and Chris, as always, it's an honor to talk with you both. Learn a lot every time. Thanks for coming on.
Thanks, Jeff.
Thank you.
Chase, as usual, thank you very much. Good to be back.
Yes.
That's it for today's show. So tomorrow we'll have Chris Bevelo back. He's joining us as host alongside Jenny Cordina from McKinsey & Company. She's going to be talking about mental health of consumers and the role of health systems in reaching them effectively, discussing when consumers will be back and how to communicate with consumers as they may be in transitioning health insurance. So a really, really, I think, important topic. If you're still listening, make sure you come back for that tomorrow. Remember to visit thinkrevivehealth.com/COVID-19 for recording of all of our episodes if you miss it. So thanks everyone, hang in, and we'll see you tomorrow. Bye-bye.